go ahead and introduce yourself if you want.
Okay. Hello, everybody out there in Zoom world. I'm Corey Weydert, Director of Rehab at Grant Regional Health Center. I have my partner here today. This is Dave Raker. He's the Director of Occupational Health. He serves the area businesses for ergonomics, so for lifting mechanics, and he sets up all of the lab screens, hearing tests for our area businesses, and you'll also see him out on the sport fields, and he works with our athletes through athletic training, also with proper lifting and strength and conditioning. So we got a good crew of people here tonight to talk about our topic of garden ergonomics. So we'll go through a little bit of a talk, do some demonstration of the 7 core exercises. We will also then have a chance to do questions and answers. So hopefully we're getting close to that start time. I think we'll wait a couple more minutes unless we're right at that time to see if anyone else is logging on.
We have 33 people so far.
Okay, we got 33 people in Zoom land.
And I just want to let everyone know that this is being recorded. And so as soon as I get it edited, I will put it up on YouTube like I did the previous ones. And we'll send the link out to everybody. Okay. If anybody has any questions, you can put them in the chat at the side too, and I will pass them on to Corey and Dave.
We do have 2 computers going, so let us know if you can hear us in that chat room or if you're getting feedback also.
Right.
That would be helpful for us. If even one person right now could comment on that before we get started, if you're able to hear us okay.
Sounds good.
Okay, good.
Yep.
Do you have the exercises attached, Nancy, for what we'll be working on, or will they be available once it's recorded?
Yes, I will send out PDF with the exercises. You said you wanted to edit them a little bit and
Yeah, I just had the pictures of them and I wanted to put the number of reps and maybe some suggestions.
Right. So I will be sending that out as well with the YouTube link.
Great, that would be good.
It's interesting. I recognize very many names. Like I said, there are a lot of people from outside who requested the link. 37. And counting.
Still getting a few coming on? Okay.
Oh, yeah. And very often people
They'll
get
join
on
in
after
as they're
6:30 too. Yeah, so.
Well, I spent the day today at the rural co-op system in Sauk City. So it involved me driving from Lancaster to Sauk City, and we meet with like 30 other hospitals from the rural co-op area. And it used to be hospitals, just small critical access hospitals around Madison. But now we have people all the way from Ashland, Spooner, Hayward, Edgerton, Platteville, and us for the southern area. So it's grown quite a bit, and it's very interesting. Those people up north are still talking about the snowstorm they're getting tonight up there, that some of them may had to have stayed overnight in Sauk City. So other than that, on the right here, a lot of water flowing, a lot of rain. I think we're knocking some of the frost out of the ground. So things are looking pretty good there. Starting to see on those south sides, those hyacinths are popping up. I saw that in the library when we walked in here today. So that gets us excited this time of the year. So I think we'll get started, Nancy. I think we're pretty close to that time. Welcome everyone as we get ready for another gardening season. We can all remember last year when we finally got out there, the snow melted, and what really got us going was this. This is what really gets me going. You got the Brex, you got the Brex, you got the Spring Valley, you got Brex, you got young seeds, and you got more young seeds. And you get all these magazines and it gets you excited for the growing season. Many of us have our seeds already planted, they're popping up and we're getting excited. So now is the time when we're not able to get out in the garden to get our bodies ready to spring into spring. So remember last year when we started the raking, the tilling, the digging, the lifting, the planting, and how sore we were. And we thought, oh boy, this is gonna be the last year I'm gonna garden. I'm not gonna do this again. But should it really be our last year? You know, let's do things to condition our body that we would be able to continue to do this lifestyle for a long time. In order to counteract the demand on our bodies to prepare for the season, we're going to go through a series of stretches, some strengthening that we can be doing right now. We could do it through the winter. So remember these for next year and get started on them right now. I'd like to talk about how we see, Dave and I see in the clinic sometimes high school athletes. They might be cross-country runners and they didn't train during the off season. They may just start their aggressive running right away. We're no different with gardeners and our weekend warrior tactics. We just kind of jump right in there sometimes and we overdo it. And if we suffer a sprain or strain, that might knock us out for a while and tell us, you know, this just isn't worth it anymore. And so what we see with those cross-country runners is they start running, they'll develop maybe plantar fasciitis, shin splints, they'll end up maybe even with a stress fracture. So injuries do happen and we want to avoid them so we're not on the sidelines. And that's no different for gardening. We all want to be out there every day. It's our form of exercise and our stress reduction. So inactivity conditions you to be able to do one thing, and that conditions you to be inactive. So if you want to be an active gardener, you have to do things to prepare your body, your range of motion in order to prevent those aches, pains, and strains. Okay. Many of us garden for the connection to the earth, the satisfaction of the joy of the harvest, sharing that harvest with neighbors, with our family, having a healthy lifestyle. There's many philosophical reasons on why we're gardening, but the rest of the gardening is just, it's hard work. But does it have to be hard work? Can we think a little smarter and not harder? And that's what we're here today to show you some things to get our body ready to help sustain this as a healthy lifestyle for many years to come. As a physical therapist, I'll work with quite a few centenarians. Dave and I, between both of us, we've been at the hospital a combined almost 60 years. So we come in contact with those 100-year-old individuals, patients, and they're quite spry. And you ask them, what's the common denominator? What are the things that are common in all of them? And what I've noticed is every single one of them have gardened. Every single one of them has put away their harvest for the winter. And that meant a lot many, many years ago when we didn't have as great access to all the vegetables and everything we have now. Having the ability to freeze, having the ability to can, they put away their produce, and they say that's why they live to 100. Their healthy lifestyle, they always got out into the garden, they got down on the ground, and getting down on the ground and then getting back up every day is what they also attribute as a common denominator to making it to 100. So just wanted to add that. So I'm not going to add that we're getting old and that's why our bodies are aching. I'll just say With each season, our body gets a little more seasoned, and we stiffen up a little more. We're more susceptible to sprains and strains and repetitive injuries. So it's important to stay in garden shape so the weekend warrior aches don't keep us out of the garden or from what other hobbies or our jobs that we do. So that's what we're here to learn about. Why is stretching important? Number one, it helps reduce the risks of injury, okay? It improves your balance and your coordination. It decreases the amount of post-activity soreness that you'll have. And it also it makes it easier to move, it makes it easier to get in and out of your car, in and out of bed. So gardening is a great form of exercise. I also want to disclaim right now, be mindful that if you have pre-existing conditions, you would want to talk to your healthcare provider, making sure that it's okay for you to do some of these exercises. And you can talk to your local provider if you think you have something serious, that you're having a problem with your shoulder range of motion. They would be happy to see you. Dave and I would be happy to work with you also with that. So a major question that people just do not like, and it seems that this is what causes injury, is pulling weeds. So what would be the number one tip for pulling weeds? It's not an exercise. It's not letting the weeds start in the first place. I think I was talking to an Amish gentleman that said 1 year of weeds give you 7 years of seeds. So once you get your weeds established, so practice using your compost, your leaves, your grass clippings, get your sticks, your coffee grounds, your everything you put in your compost, use that over top of the earth after you plant. You can choke those weeds right out where they're not developing. There's also, if they do develop, a lot of ergonomic tools. Nancy likes her Cobra tool. They make them in a long handle or a short handle. It has like a Cobra look. It gets down, gets the weed out. I like using a true action. It's kind of a trapezoid blade on a long handle, and you can pull it back and forward, and it cuts the weeds down at the level underneath the roots. And it also helps to get them before they establish their seeds. So we will show you some exercises that you can do for pulling weeds that strengthen your posterior shoulder. But I just wanted to mention other techniques that you can use. A standing weed puller, Fisker's makes a good one, where you put it down into the ground, you step on it, grasp, pull it up, it pulls that really long taproot right up. Because we're very conscious, we put too many chemicals in the ground, and you can do other methods, make the chemical the last method that you need to use when you're approaching weed control. But you have to balance the pros and cons of that. If your body is not in good shape, you might have to use a little more chemical because you're not able to do the stooping and the bending for weed removal. All right, we're going to get into the demonstration part of our program. The first thing we're going to talk about is abdominal bracing. This is the core critical exercise that all the other exercises and activities that you do are based on. So here's an example of the spine. Okay, forward and to the side and the back. The spine and the muscles form a cylinder in the body. Okay, we have muscles that attach of our abdominals that attach onto the pubic symphysis in the front of the pelvis. We have back muscles that come down and attach into the back. So a lot of people think I got back pain. It's from my back muscles. It's actually the whole cylinder, and I'll explain it with these two cans in a little bit here. So our abdominal muscles perform a force that can pull the pelvis this way. We also have hamstring muscles that attach on the tuberosities of the pelvis. So when those are tight, they can rock the pelvis this way. When we want it to be neutral, our hamstrings are really tight. They're going to cause that. That's going to put strain on the low back muscles. We also have the muscles of the oblique that come in and attach into the abdominal muscles for the side. So the thigh muscles come up, they attach into the pelvis. So all of these dynamic muscle groups are coming in, and we really want to form an abdominal brace exercise that strengthens that cylinder. Okay, so I'm going to give my demonstration here. Hopefully everyone can see these pop cans here. All right, when we have a strong cylinder to the spine, our front muscles are in good range of motion and strength, our back muscles have it, our hamstrings have it. When we put pressure on the spine, it can take a lot of force. That's what the spine is designed for. But let's say you have weak abdominal muscles, you put a little crimp in the cylinder, and then you put force on it, and that's what you get an injury. So that's a simple way of thinking. It's not just back muscles that contribute to this, it's the whole area of the spine. And when all those muscles are in conjunction, you can take a lot of force through there. So if there's one thing you remember, the crushing of the can and the importance of strengthening all the muscle groups. All right, so we'll clear this off. I'll have Dave up on the table here. And again, this is the first exercise of the 7 that we'll go through tonight. All right. So we start by lying down, and our hips and our knees are bent. Okay. And then I asked Dave, place your fingers on your abdominal muscles. We want to sense when they're firing. Okay. So he's got his fingers on there, and then we'll say, this is a little hard, but once you get it, you've got it, and you've got it for good. Some people arch their back when they do it. They don't have the concept of finding their abdominal brace. But what we usually say is try to draw your belly button towards your spine. So you try to draw that belly button up towards the spine, and you can feel yourself engage. You'll feel a little bit of the back flatten up against the surface. That's what we want. We don't want to lift all the way up off the table with this at this point, but just find that abdominal brace position. That is a position that once you find that, we can advance to other progressions of exercise. We can do the brace exercise, and then we can do alternate leg, hip and knee, bringing it up towards the chest. And I usually will feel on a patient if they're losing that position by placing my hand under the small of their back. We want that to stay nice and flat there. Okay. Other things we can do too is we could put a pillow. We'll pretend my fist is a pillow. We can put a pillow there, and we can bring both knees up towards the chest. That's even higher. These are kind of designed by the Norwegians, have them cornered the market on this lower abdominal strengthening program. So you want to do enough of those 10 to 20 reps, or you want to do enough that you start feeling a little bit of burn in your abdominals. So Dave could even take it a step further. He's strong. He can bring one knee up. He could work at kicking it out straight, holding that brace, bringing it back and down. And then he could do the next one, bringing it up, hold that brace, bringing it out, bringing it back and down. A lot of people will say, I want to do exercises to lose the gut, and they'll do sit-ups. Sit-ups are attacking a muscle that runs deep along the spine, and it runs with another muscle that's on the inside of the hip, and it comes down and attaches right here. So when you're doing sit-ups, you're strengthening that muscle that's deep in the spine, and you're not targeting the lower abdominals at all. This is a key exercise in those progressions to help a lower abdominal strengthening exercise program. You might see people with a Swiss ball or a TheraBall. They can incorporate that into the program also. So that is the key. Once you are good with that, you incorporate that abdominal brace when you're standing. You can do it while you're squatting, and you'll do it while you're lifting. And we'll show that in a series of the next exercises that we'll be getting to a little bit later. So very important, abdominal brace. Everybody try that at home. Do it in your bed tonight. Work on drawing that belly button towards the spine, feeling you engage those muscles, feeling your back flatten. That is what you want to do. And important, don't hold your breath. If you're holding your breath, you're not doing it right. You can talk as you do it. I'm doing it right now, and I'm talking and I'm not holding my breath. Okay, I just let it out. Okay, there I just drew it up again. For women and men for pelvic floor health, also, when you do this one, it also engages the Kegel response too. So urinary incontinence, that type of issue. This exercise is also a precursor for a Kegel exercise too. So there's a little extra bonus there. Doesn't have a whole lot to do with gardening, but it has a whole lot to do with our health. So, okay. Our next one that we'll do, that Dave will demonstrate, is we're going to do chair squats. So why are squats important? Squats are a way to keep the repetitive motion of the knee and loading it so that we're able to strengthen our thighs. So I'm going to tilt this down a little bit so we can focus on Dave's lower legs. So for the squat, we do this when we lift ourselves up from the ground, when we're squatting down to pick something, to plant something. So it's very important in everything that we do in the garden. So we're going to demonstrate this. We're going to do slow, steady squats to the level of the front of the chair. And then we'll work towards not sitting all the way down, but just lightly touching. So he'll go down almost like a 2 to 3 second and touch, and then back up. Okay, I kind of tease my patients a little bit that sometimes this, I call it the Zippy's brass rail exercise, that you're sitting down on a bar stool and then you're popping back up. But some people just have trouble sitting on the stool too long. All right, so that's what we do. We want 20 to 30 repetitions of those, and we want to do those until our thighs start to feel a burn. And Dave, do you feel it in your buttock a little bit too? So point to where you feel it, targeting there and there. Okay.
Squeeze your butt cheeks together.
All right, the next one that we're going to do, it's what we commonly do. I use my hold, I use a shovel, and it's the golfer's lift. It's what golfers do. They use their golf club when they do this. So Dave is going to demonstrate this one. So why is a golfer's lift important? This allows you to take the strain off your back when you're performing repetitive bending. So you're doing a lot of bending down, putting the seeds in the ground or what have you. It's when you're doing a light load. You don't do this lift when it's a heavy load. So you're pivoting from your trunk, from the hip. Okay, you're weight bearing through the tool for counter support. You're raising your back leg to the same degree as your front is reaching down for an item. Okay, probably you're picking up a trowel or something like that. So you're holding on. When you get good at it, you can do what Dave's doing. you're working on your balance and coordination without holding on to anything. So he's keeping his back nice and straight from the neck to the spine, and he's trying not to get a whole lot of rotation. When rotation occurs is when we see our injuries occur. Rotation with the load on it. So, yep. Very good. So that's a golfer's lift. You practice that 10 to 20 times. Get good at it. You're doing your abdominal brace when you're doing that. That's keeping everything in line. So, okay. So keep the back straight, switch to your sides, do 10 to 20 repetitions. You're going to feel, you won't feel that as much as you'll feel a chair squat or the lunges. And that's what we're doing next. We're going to do lunge strengthening. And why is that important to do lunge strengthening? It builds the strength of the thighs, and it also helps us to get up from the ground. So we can use a chair, and I'd advise 2 chairs at home to start out with if you're just starting with this. So you want to tilt that down just a little bit. Maybe bring it forward a little bit. Bring your chairs forward a little bit. So for a lunge, what we're going to do is you're going to take about a 50% longer step than normal. Okay, that looks good right there. And then you're going to drop your knee straight down. Your back is going to stay straight, as you can see how Dave is demonstrating that. The knee doesn't necessarily have to touch all the way to the ground, but you're also doing your abdominal brace as it goes down. 2 to 3 seconds as you go down, a little slower, and then 2 to 3 seconds as you load yourself back up. Okay, this is one of those things where I say inactivity conditions you to do one thing to be inactive. So you can't expect to go out and do this motion out in the garden without actually working on it. So doing your 10 to 20 repetitions and then switching, doing the other leg 10 to 20 repetitions. Now, particularly if you've had a total knee, you know, you got to have at least 105 or 110 degrees of knee range of motion in order to do this one and not create injury. So again, before you do some of these things, you have to consider what level of condition your body is in. Okay.
Don't engage that core, you'll stick your stomach out, then you put more stress in your low back. Keep that core engaged. More bracing.
Yep. Good. Okay. Dave, if you want to grab the weights, we're going to do bent over rows. This is another exercise that we will do. Why is this important? It helps us to strengthen our posterior shoulder, so the muscles that are in the back of the shoulder blade. Okay, when do we do this in the garden? Anytime we're bending forward, we might be pulling weeds, we might be hoeing. Okay, so that's what this is going to get us ready for. So bent over rows. So we're again going to bend over at the hip. Okay, Dave's going to let the weights go down towards the ground. Okay, and then he's going to slowly pull it back. Weight drops down, and then he pulls the arms back like you're rowing a boat. Okay, you want to be very conscious that you're squeezing. If you want to turn it towards me, you want to squeeze. That's good. Yeah, you want to squeeze the shoulder blades together. Okay, now go from the side again, Dave. We don't want you to shrug your shoulders. Don't do that. That's going to overuse your upper trapezius muscle here, and you're going to end up with a neck ache with that. So this is strengthening those shoulders. This is the one that I think I need to work on the most, because I'm really sore after I do little spot tilling. I don't till rows anymore. I just spot the spots that I'm putting the tomatoes in, and I really get sore with my tiller with this one. So I need to work more with this one. Okay. So that is the bent over row. Again, squeezing the shoulder blades together, not bringing our shoulders up into a shrug. So much of what we do during the day with our jobs, and as we get more seasoned, is everything is forward. Computer work, working as a therapist and bending forward, anything, a lot of what we do is forward work. A lot of what we do in the garden is forward work. So really we need to counterbalance that with strengthening those posterior shoulder muscles. Very, very important. Okay. A lot of your reaching that you do is your stabilization of your posterior shoulder allows you to do overhead reaching. So, all right, next one we're going to do is a farmer's carry. And it seems like, well, why would I want to work on this? I'm just going to wait to do this until I start gardening. But you can practice. So you're going to grab a bucket. Dave has a bucket here. Okay. You're going to put like half of it with potting soil or put half of it with water. Okay. And what we're going to do is we're just going to practice the demand of carrying an object. The demand when you're carrying it on one side, you want to be careful that you're not hiking your shoulder up. Okay. Don't want to do that. We want the load down and we want our spine to be as straight as we can. We don't want to be really turning it to the side because it's too heavy. Okay. That is going to cause an injury when we do that. So this one is just simply filling that bucket up, walk 10 to 20 feet one way. Okay, put the bucket down, turn it around, bring it up, and walk 10 to 20 feet that way. And you're just working on that abdominal control. Each time you pick it up, don't bend over at the back. Practice your squat as you pick it up. Okay. All right. So that is number 6 of tips for gardening exercises. We're going to do, the last one is called the deadlift. And this one we do use a lot in gardening. And why is this important? Deadlifts mimic the technique that we use whenever we're lifting anything heavy from the ground, whether we're lifting up a heavy bag of potting soil, a heavy planter, anything like that. Envision a heavy wheelbarrow that you put a whole big load of bark in there, or compost. That motion that you're grabbing that wheelbarrow for the first time, that's what a deadlift is. That's what we're practicing with that. So Dave is demonstrating it now. We do this lift when there's heavy objects. This isn't when we would do a golfer's lift when there is something heavy. This is designed to help us with that. So Dave is using his thighs, his buttock. He's using very little of his spine. He is not doing a torque motion on his spine. And that's the important part of avoiding a back sprain early on as we get started in the garden. So his weights go down to the front of the shin, and then he just slowly brings it back up. Okay, so it drops down. The trunk is going to lean forward slightly. And once the hands get to the shin, you come back up, return slowly, and that could be 10 to 20 reps. You can start with no weights right away, and then you can add weights 1 to 3 pounds. Dave has 5 pounds. So that is showing the deadlift exercise. So we just went through 7 core exercises. If you would go through these, I would imagine they'd take you 10, 12 minutes to go through these. So it's good prep to get our bodies ready for the gardening season so we can go at it and not be that cross-country runner that develops plantar fasciitis or shin splints. But should you develop those things, we also work on, we try to do this as preventative maintenance, but we also work on exercises to help people after they've had injuries too. So I guess I just want to close by saying, when we start something too fast, we might say, this is it, I'm not going to do this next year. And the focus of tonight's program is to say, no, this isn't going to be my last year. This is something that I'm going to want to do for the rest of my life. So I'm going to develop this program and stay healthy so that I can continue to garden. Other things to think smarter and not harder would be bring the garden up to you. As we get more seasoned, we may want to look at, having a cattle water trough filling that up with the proper drainage and having your raised beds come up towards you. Do that with a smaller version of raised beds. My dad is 83. All of his gardening is done with raised beds now. That's also working smarter and not harder. He has very little problems with weeds. The paths are barked, and my mom doesn't yell at him for coming in the house with dirty shoes on. So we're here to make gardening fun. My goal that I have is I'm a superintendent in the crops building for the junior class for flowers and for the vegetables. And we want to see people continuing to do healthy living, healthy lifestyles. We really saw an upsurge of this during COVID. You had a hard time finding seeds to buy because everybody was getting into gardening because we wanted our produce locally sourced. We didn't have to rely on going to the store. We knew what was in control of what we were putting on our produce. I know out in the news just yesterday, we're adding different vegetables to the dirty dozen list of most vegetables with sprays and that. So you're in control of all that. So I am passionate about gardening, and I'm also passionate about preventing injuries. So that was our focus of tonight. So that this year isn't the last year, we'll have many more years. So I want to thank you.
Well,
We
we
can
have
look
some
at-
questions.
Yep, if we have
Okay.
questions, let's
Yep.
hear those.
Okay.
Dave and I will be happy to
Address
answer
those,
those.
yeah. The first one was the abdominal exercises. Do you have to do those on the floor, or can you do them on a bed?
If your bed is fairly firm, you can do it right in the bed. It's going to be pretty easy. You'll get the concept down with drawing that belly button into the bed.
Mhm.
If you have a really saggy bed, it might be a little harder, but no, you don't necessarily have to get down on the floor. We kept Dave up on the table with a yoga mat. So, yeah, no, you can do it in bed.
Okay.
Yep.
I have a torn meniscus. Can I do these exercises?
Okay. We'll say, has the meniscus been repaired? How much range of motion does the person have? The first thing you'd want to do before you do the strengthening is make sure that that knee with the torn meniscus has almost 85–90% of the motion. That you compare to the opposite leg. If it's bending and straightening, a lot of times with the meniscus, you'll see a person isn't able to straighten their leg all the way out.
Mhm.
It catches, there's a little crook in the knee. The knee doesn't go all the way down straight. You need to work on that first. That is a very good question. Work on the range of motion before the strengthening. It's a vicious cycle. As soon as you have that injury, you'll develop weakness around the joint. And when the weakness develops, then you'll lose your motion even more. And then you lose your strength even more. So yeah, work on that range of motion. Bicycle, non-weight bearing activities to help with that meniscus. We want blood flow going into the joint too.
Mhm.
We want the knee joint is a synovial membrane, meaning when the knee is moved, that membrane releases synovial fluid. When that knee or shoulder doesn't move, it desiccates, it dries up, painful. You lose your motion, you lose your strength. So gentle motion to a joint, even with a torn meniscus, is beneficial. You'll get more blood flow going into the area. Aquatic exercise, absolutely fabulous for a meniscus injury. Sometimes it just gets to the point. A little scope surgery, clean it up. You may be able to tack it down depending on where it is, or clip it up and trim it. And you can go many years getting your motion and strength back around a joint that has a torn meniscus.
Yep, the person said they have not had surgery yet and they have half range.
They have half range.
Yeah.
Okay. Recommend finding an orthopedic minded family doctor, or whether they see a chiropractor that has a sports kind of ortho minded, or talk to a athletic trainer or a physical therapist would be beneficial.
Okay, how to properly push a wheelbarrow when it's fully loaded.
All right, well, demonstrating that deadlift. Okay, so you're not going to bend forward okay? You're not gonna bend forward to grab that wheelbarrow and having it way out in front of us. You want to engage that wheelbarrow almost within your base of support. So you got those handles right here as you go down. That is close to your body as you go to start to push it. And then just making sure if you've got it overloaded and you hit a little divot and it goes, you've got to know that you're strong enough to counterbalance that force and not develop a strain in the back that way. Do several loads instead of one big one.
Yeah. Can you address kneeling devices?
Kneeling devices.
I
Okay.
presume you mean like those little kneelers where you have handles that you can push yourself up.
Yeah, if you have the range of motion to get down on the ground, I like to strap on, they're called Irwin gel pack. They let your kneecap float in a kneecap pad. So whenever I'm kneeling excessively, and I have a total knee joint as of a year ago last week, I can get down and kneel if I've got that knee pad on with the gel pad in there. That allows me, and I always have something nearby, whether it's a bucket or a chair. I use a little garden stool a lot that has a seat that rotates with the big pneumatic wheels on them. It can go up high, it can go down low. I use that a lot. Okay, if you have one of those kneelers, you can get the one that has a little platform with a pad on it, and it has where you can get up from it. We always like, Dave, do you want to demonstrate? You can tilt that down, Nancy, or Dave can tilt it down. Okay, Dave's gonna be kneeling down on the ground. That looks pretty good there. Yep. Dave's gonna kneel on both legs. Okay, so let's pretend he's got a bucket here that he's got his weeds in there. Okay, we'll bring the bucket over here. He wants to counterbalance himself right here on that bucket. So let me bring it up a little bit more here. All right, so he's counterbalancing on that bucket. And now he's gonna work up and get on one half kneel position. He's gonna get up, opposite leg. He's gonna push down through the bucket and load himself as he comes back up. That would be a good way to get up from the ground. So from a double knee position, have something nearby to hold on to on the opposite side, come up, and then push yourself up. Those half lunges, if you're injured and you can't go down very far, even doing a quarter lunge in the chair would be good.
Okay, one person commented that yoga's been really good at addressing a lot of the stretches and strengthening.
Absolutely. Yoga, aquatic therapy, a lot of your alternative, non-traditional type exercises, very good. Yep.
And I heard it's good to kneel on one knee at a time, not both when weeding.
Yep, it puts a lot of strain on the low back when we have both knees. But it seems like if we're down on our ground, like a saddle position, side windswept position with both knees down, and then you go to get up from that position, a lot of times you have to get in a double knee position in order to transition to that half kneeling. But yeah, having your knee cushioned, when you're kneeling, you are directly on your cartilage surface of your knee. So if there's a little piece of gravel or a little clod of hard dirt, you're right on directly on your weight bearing surface when you're kneeling. So that's why knee pads are good, or just a garden pad that you throw down on the ground. Good questions to prevent injuries.
One person said, I tend to squat a lot while pulling weeds. Is this okay? It's tiring.
Yeah, I wonder how old that person is that's able to hold that squat.
Yeah, I
that long.
can't squat like
No, I can, you can see really spry elderly that can get down into that squat position and stay there. I would say when you're getting into that position, you are going to the extreme end of your range of motion, and you could be apt, if your knee twists or turn a little bit when it's bent that much, you can kind of torque that meniscus a little bit. So probably not the best thing. I know my father-in-law is a dairy farmer. He wore the little half bungee stool that was strapped to his butt. So he would get down into a squat, and to this day, My father-in-law can squat
Mhm.
all the way down,
Yeah.
but he had that little bit of buoyancy there with the spring that when he squatted down to do this milking, it was enough to take the pressure off. So you would want maybe something like that and not staying down into that squat position. All right,
Okay.
I'm glad there's a lot of questions.
Any suggestions for being kind to arthritic hands while gardening?
Oh, boy,
Yeah.
yep.
Mhm.
Yeah, you know, I was talking to my mom last night. My mom is the flower gardener in the family, and she was saying, Corey, you gotta mention something about arthritic hands. And I told her at the time, go on and just Google search ergonomic tools. Tools that keep your wrist in a neutral position. Get a shovel that has a handle on it and maybe has a bend in the shaft of the shovel. That's gonna help with the lifting and not putting as much stress on the wrist. What are other things that we would say?
I'll do it for like 30, 40 minutes at a time.
Yeah, take your
Take breaks.
breaks and do your wrist stretches. Also, build up the handle on your tools. A lot of tools now will have a foam grip on them too. The more you can build that handle up and you're not, you know, you don't have strength when you're down into this position, but you have strength when you're in this position. So build up your handles on your tools. You might find like, you know, maybe your rake, slide a pool noodle on your rake and have that a little wider so that you're able to grip it and not for those fingers that are weak. A lot of tools that you can use, ergonomic tools, Google search that and you'll find things. You can even put tools for arthritic wrists and hands and you'll get a lot of ideas that way.
Pipe insulation might work well too. It's
Pipe
not quite so
insulation,
bulky as
not
a
so
pool
bulky.
noodle.
Yeah, the pool noodle will have to be the smaller
Yeah.
of the ones. There's a
Right.
couple different sizes of those pool
Mhm.
noodles. Are kind of, some that are like this and there's some that are more like that.
Mhm.
Yeah.
Yeah, and a person mentioned that they wear wrist braces.
Yes.
For the arthritis, yeah.
Yeah, that the wrist brace would be counteracting that repetitive motion. And
Mhm.
if you've got hard dirt, you got clay dirt,
Mhm.
you're gonna be dealing with a lot of shock that comes back. So
Right.
having gloves that have the padding in them, that's also helpful too, having the shock absorbing gloves on. So,
Yeah.
yep,
Okay. Well, that's everything so far.
that's all the questions. Okay.
Okay.
Well, guys, all of these things are coming. They're coming every day. I hope you're getting them all ordered and you're getting back out there and doing what you want to do for gardening. So we're always welcome to have any questions afterwards too. We'll have this recorded. I'll have the pictures of those exercises that we did up in a PDF and Nancy will get that out to everyone. I want to thank you for attending tonight and many happy years of gardening.
And many people have said, thank you, it was excellent. So,
Okay, great. Thanks, Dave, for being a subject. It's great. All right. Take care, everybody.
Good night, everyone.